Hi everybody and welcome back to my channel. The purpose of today's video is to help give you a walkthrough on how to perform your gut intelligence test. Right, this is a home this is a home test kit which consists of you providing 3 samples that's going to be sent to the lab in the US. Please understand that this is the only test in the world because it has patented technology purchased from the government where it assesses your gut and your oral microbiome, your mouth health, as well as your cellular health at a genetic level. So it's really comprehensive, full of data, expressing what maybe your genetic predisposition to disease is. It's going to be telling you about your food. It's going to be telling you about your age. Let's call it your real age versus what the age of your health is expressing. It's going to be telling you about your inflammation, about the viruses in your gut. It's going to be telling you what nutrition and supplements you need. It's going to be telling you about your organs. It's going to be telling you about your stress levels. It's very comprehensive and an amazing test. And essentially what people can do is look at doing this test maybe between 6 months to a year, depending on what your markers show up, especially when it comes to your brain performance, your cognitive performance, and many other markers, because there's quite a number of markers that are showing, more than 50 markers. So in order to achieve that, we're doing from mouth to anus assessment, right? So what there is going to be 3 samples. So it's broken up into 3. So you're going to open up your kit. The first thing you're going to do is you're going to get this booklet. First thing you're going to do is download the app and register your kit, right? Which is pretty straightforward and simple. As I always see people make mistakes of, read the booklet before you do anything, and then read the booklet again, and then do the test, right? Best advice I can give is to do the test, have all the samples prepared where they need to be. For example, the saliva ready first thing in the morning. Maybe the best way to booby trap is actually putting it in the kitchen, because you go, oh, I'm gonna get up, make my coffee, and then you go, oh no, I can't, because I have to do the saliva test first thing in the morning in a fasted state. You'll keep your stool sample equipment ready next to the bathroom, and then your blood, of course, your blood sample, I don't know where you want to keep it, but maybe in the living room. And the reason for that is, especially when we're starting with the mouth assessment or the oral microbiome, is that people don't know that digestion starts in the mouth. And so this needs to be done in the morning on a fasted stomach. No water, no food, no beverages, no brushing teeth. Because at night, when the body essentially should be resting and digesting, even though that's not really happening in people's worlds today, is that the bacteria is doing a lot and it's expressing itself. So we want to get an accurate snapshot of what is going on with your oral health. And to date, with all the tests that I've seen with my clients, I've yet to see someone, including myself, have good oral health. And so if our digestion at the starting point is compromised, we swallow that, then it's only a negative knock-on effect. So we really want to look at improving our oral microbiome, our oral health, in which I will help provide that information to you during our consultation when you get your results back. Right, so you will notice you get 3 kits here, right? So I'm going to read you this, and we're going to literally have a walkthrough just so everything's clear, simple, and explained. Right. Let me open up the page. So what's going to happen is you're going to open up your kit, you're going to download the app, and you're going to register your kit's you're going to have, sorry, this is a dummy kit, right? You're going to have a registration code, which you're going to link and register your kit, and then that's going to happen. Then you will have access to completing your health questionnaires. It can take some time depending on how many health issues you have, but it's important to give as much information as possible so the sequencing paired with your DNA can feed back what is accurate and priority for you to focus on as well during your results. Right, so One or a couple of important facts and information to know is these samples will contain a solution in. You don't want to overfill, you don't want to spill, you don't want to throw anything out, because that has happened. You want to try store it safely. And important to know, especially if you're someone who doesn't go to the toilet every day, is that the sample has a 28-day lifespan. So what I try get people to do is, if they, for example, don't know when they might be going to the toilet, because sometimes I have clients that go every like 4 days, I would say wait for the day that you have your stool sample, and then the next morning do your saliva and blood, or maybe if you haven't eaten yet, then you can do your blood as well, right? So with the saliva sample, you'll have a collection tube with a funnel. It's got some solution in. And then you'll have this cap. Perfect, right? And then you'll have as well at the bottom, where you'll take this out, your sample bag that will be sent in. Right. So what you're going to be doing, as they say here, time to collect your sample. So collecting it within 1 hour of waking up, before drinking and eating. They say water is okay. Do not brush teeth or use mouthwash. Do not unscrew the funnel portion on the saliva collection tube. Yeah. So a lot of people tend to try and screw off thinking what's happening, what's going on, and then they mess up the sample, right? And also, if you have difficulty in collecting enough saliva for this test, try use techniques such as gently rubbing your cheeks to generate saliva, gently gnaw or chew on your tongue, or think about sour food like lemon, or maybe your favorite food. Right. You're going to rinse your mouth out with a little bit of water for about 10 seconds, and you're going to spit it into the sink, right? Then you're going to grasp the collection tube near the bottom and remove it from your kit. Try to avoid placing your fingers on the inside of the funnel, and lay the kit contents on a clean paper towel, right? Then you're going to cover your saliva in your mouth and then spit it into the funnel. And what you need to essentially do is get to that red line, right? If you overfill, pour some out. So again, there is a specific ratio between the solution and your sample or your biological specimen. So you need to not overdo. And also don't measure the bubbles. You need to have solid saliva, if that makes sense, right? Once that's done, then you're going to unscrew the top and lift it out. Then you're going to close this cap, right? And then once that's done, you're going to shake it for about 15 seconds, and then you're going to place it in the sample bag. I'd like to say pretty straightforward and the easiest one of the lot, right? And perhaps less gruesome as well. Right. Then we're going to move on to your blood sample. This for me is the trickiest one. Almost everyone seems to have difficulty in achieving enough blood for some reason, and I'm not sure why. But what I encourage is to drink half a liter of somewhat warm water, maybe of warm water, and then you're going to drink that maybe about half an hour before you're going to take your sample. Then I want you to have a really hot shower for about 5 to 10 minutes, clean and sanitize your hands effectively, and then just do a bit of jumps or jumping jacks on the spot. When you're ready, then you're going to prick your finger with the lancet, and don't squeeze. So for example, I use always the middle finger, I find, because it's the biggest pad of the lot, or at least on my hands and other people's hands. But I prick the pad about there, and then I have the hand upside down, and then I will milk it. You don't milk it to the last part of the joint, because you can create, blood can congeal, and then basically you get inaccurate results. But you just want to milk it down like this. Some people have the little purple applicators, but I find it much easier to just do it directly in the vial. But remember not to try and knock it over, because it contains a solution. What you're going to be getting is 2 vials to fill. And what you need to do, again, it has solution, is fill it to the exact line, which is 0.5, right? Because you don't want to overfill it, because you're like, yes, all the blood's coming out, because then the solution ratio will be diluted and then not good, and then your sample will fail. Right, so you get a whole bunch of these things, and these are your 2 samples, right? You can see there's some fluid in there, right? So you want to get to a 0.5. So the solution's already about a 2.5. So it's actually not a lot of blood. Usually I'd say 4 or 5 drops of blood, depending on how you bleed, right? So you get 2 Lancet in case you fail, but essentially what you're going to do is you're going to, well, in this thing, they say you get a blood collection tubes, you get 2 alcohol pads, 1 sterile gauze, 2 Lancets, 2 mini vets, 2 bandages, and a clear bag, right? You're going to lay it all on the table, just so it's easy, so you don't have anything knocked over. If you're going to do it on the table, put the tubes that you're going to fill more in the center of the table, because I've had some people knock it over. It's not very good. And then when you're ready, you're going to clean with alcohol. You're going to let go of the Lancet. That's pretty self-explanatory. Then you're going to prick, and then you're going to bleed. You take the little gauze and you're just going to wipe off the first blood. And then what they recommend is to fill up with these little purple bits and bobs, but I haven't found them to be as effective and helpful, so it's really up to you. I just do the straight milking the cow, right? Then you fill it up, and then you put it into the vial, and then you put your bandage on, right? Then once that's in, you close the vial firmly and you shake, 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 shake rigorously. Right, so the solution is mixed. I usually do for about 15 seconds, 30 seconds, sorry. So I will usually mix it for about 30 seconds, and I do both at the same time. And you put it in a clear plastic bag, right? So here they give some extra advice. If you're having trouble filling the mini vets, so these little purple collection tubes. So here they say if you're having problems with actually collecting it in there, then you can just drip the blood in, right? But don't overfill. Right, then we go to your last sample, which is your stool sample. So it's pretty clear. So you get basically the tube to collect in, you get a stool collection paper and the clear bag. Right, and you get a measuring tape, right? So what's going to happen is you're going to open up this paper and you're going to stick it on either side of your toilet. That's going to create this dip. You're going to poop on it, and then you're going to take and open up your sample with the spoon in it, literally. Then you scoop 1 scoop of poop. You're going to put it in, and then you're going to mix it, right? The leftover poop, you can literally unstick the paper and flush it all down, right? It is disposable, right? Just as it says here, use 1 small scoop, the size of a green pea, not heaping, right? Because some people are quite, yeah, get a lot of poop. Right, close it tightly and then shake for 30 seconds, let it rest for 30 seconds, and then do it 2 more times, right? Then put the sample in the bag. Done. Then you have the measuring tape, which you'll need as part of your health questionnaire, because you'll need some measurements. And then because you're based in the UK, it's a very different shipping, different shipping process as it is compared to the US. So you get a little customs bag that's already made. It's called a CN22 form. So when you go to the post office, you will have to pay for this postage yourself, and you can decide if you want to do first class to get it received within 5 days, or if you want to do second class, which can take, I think they say up to 21 days. Just really up to you, your budget and pressure in terms of how quick you want to get your results. Remembering that there is about a 2 to 3 week lead time once it's been received into the lab to actually get your results, right? So when you take this, you put all 3 samples in, then you'll say to the person at the post office, I'd like to post this. They're going to say, how much does it weigh? This already has weight in it. So it's 0.042 kilograms. And they'll say, how much is this worth? And you go, how much is my poop worth? Millions. But the value of this parcel is only $6.29. Right, if for whatever reason it gets lost, and as I mentioned, it has a 28-day lifespan, it expires for some reason, I will give you a replacement kit free of charge, right? So when you go there, they will ask you what is in the parcel. You'll say it's human specimens, but this is exempt. So finding the ideal career that will post for you. So from what I understand, Every doesn't do human specimens. So it could be Royal Mail or maybe FedEx or DHL, etc. And then you will pay for that. What you do need to do is have a label pre-made, and you've got your address at the back of your booklet to explain that. And then you'll stick that on, and then you'll cover it, and then basically get shipped. When you get your results, you will contact me. You'll send me your login details, because the way that I will get access to it, I need the comprehensive view. So I need your login details. So think about the password that you're going to use and choose, that you will let me have privacy and access to. And then we need to book a consultation. So most people have now requested from me to actually send them a recorded voice note, just to explain to them the process and what's going on and what's showing up and what I recommend and what lifestyle changes and supplements and even services to recommend. And people have again asked if they could just have that accessible as a recording, so they can revisit, because there is a lot of information. And so then that's your test. And ideally you'll be reperforming this maybe 6 to 12 months, depending on how many markers either really need attention or need improvement. And then we can sort of improve your health at a really precise, accurate, scientific level and just get you better. So a really fantastic test. And so hopefully this video has helped you. And if you have any more questions, you can write them in the comments below, because maybe someone else might have the same question that might be answered, or you just contact me. All right. Have a lovely day and good luck with your test. And I look forward to sharing your results with you. Here to longevity.